low back pain, sciatic pain. If you are suffering, then this video is for you. I'm gonna go through my top 5 exercises that you can do tonight at home that's gonna give you relief and help to improve the low back. I'm Dr. Matthew Posa, and this page is dedicated to people and families with tips and tricks so that they can live a healthier, better life. So please like, subscribe, and don't forget to share this information with people that we know are suffering. A quick anatomy review. In the low part of your spine, the low back should be nice and straight when you look at it from the front, and the pelvis should be even. When we look at it from the side though, there should be this beautiful arching curve, and then you can see your pelvis and your sacrum, which is this middle part, the part that you pretty much sit on, should be in the right alignment. When the spine is in the right alignment, then there's no pressure on the discs or on the joints or on the nerves. And then with sciatica, it's an irritation, inflammation of the sciatic nerve, which is a collection of the nerves that come out of your pelvis, so it's quite a big nerve, and it goes down your leg. Normally it'll go past your knee all the way to your foot. So if that's what you're experiencing, then there can be a multitude of different types of issues causing that. And most notably, it could be trauma or lifting improperly, repetitive movements that are wrong, just doing the wrong thing over and over, prolonged sitting, weakness in your muscles, arthritis or degeneration in the low back, disc bulges or herniations, misalignments in your spine, pregnancy, stenosis. These are all the types of reasons that somebody could be experiencing this. And so this is why you need to go to a spinal expert. You need to go to a corrective chiropractor to get this properly assessed so you know exactly what you're dealing with and what you can do and the steps that you can take in order to get better. So this is exactly what you can do at home. We're going to start with seated glute stretches. So the glute muscle can be really tight, compressing some of those nerves. So while you're sitting, you're going to bring one leg up. You're going to be pushing down against your knee a little bit and then hinging forward. So you're bringing yourself a little bit forward. When you do that, you're going to start to feel a pull in your glute. You can also do that same one laying down. So if you lay down on your bed or on the floor, you're going to bring the opposite knee up. This one, your one knee over the side, and then you're going to bring that closer to you. So if you bring that closer to you, you're going to get a deep stretch in through your glute. If you want to target the piriformis muscle, and some of you have probably heard of the piriformis muscle being one of the contributors to sciatica, then instead of bringing this completely towards you, you're going to grab your knee and start bringing it more midline, so towards the middle of your spine without lifting your low back. Make sure your low back stays against the floor. If you start to lift your low back, especially if you have any spinal issues or if there's disc herniations or anything like that, then you can be adding excessive amounts of rotation and can be making the problem even worse. So you want to bring this over like this, stretching that until you feel relief, usually around that 30 to 45 seconds when you're doing that stretch. The next stretch I want to show you is the sitting spinal stretch. So we're going to be stretching out the low back. Sometimes I like to call this the Madonna. Don't know why I do that. But if you bring one leg in front of the other and you're going to twist this way. Now you're not trying to over twist or do a quick movement because then you can cause a misalignment in your spine. You want to guard that. So you want to bring one leg over, and you can do this sitting, and then your forearm on top of your knee, and you're twisting your torso to one side. You're just holding that position. And usually I would start with the affected side. So if you're having sciatica down your left leg, twisting to the left would be the side that you would pick at first. And you can repeat that on the other side if you need to, but it's a simple way that you can really get a low back stretch. Now, if you're getting any pain with that, if you're noticing that it's increasing, and to be honest, with any of the exercises or stretches I show you today. If anything causes you excessive amounts of pain or worsening of the symptom, please stop. Do not continue, and make sure you go see a professional. The next one I'm going to show you is the hamstring stretch. So the hamstring stretch can be done sitting or standing. I like to do them standing because then you get a better hinge. In your pelvis, your hamstring is attached to the sit bones, so the part that you'll actually sit on, and they can get really tight. Now when they become really tight, they can pull on the pelvis in different ways and cause these misalignments that put pressure on the nerves coming out of your spine. So it's one of the reasons why. So this stretch can help you quite a bit. In this case, you want to bring the affected side, so let's say it's the left leg, once again, you're going to put it on, you're going to prop it on something. So it could be a table, it could be a couch, it could be a chair, but you want to start small. What that means is you're going to make sure your knee doesn't come up when you're bringing your torso forward. So the goal here is that you're going to bring your torso forward. You're not bending anywhere in through the top, but your knee needs to be down. So if you're having a hard time with this, very simply, make sure your knee doesn't prop up. And the moment it wants to, that's as far as you're going to go. And if you need to overpressure, you can put a little bit of pressure through your hands in through the front, but you really don't have to do that. You just go into that point of tension and you're going to hold that for 30 to 45 seconds. And you can repeat that as much as you want, but you want to make sure you're getting to that 30 or 45 seconds. So that way you're getting those neurological changes that we're looking for, especially in through that muscle belly. This next stretch is called the knee to shoulders or knee to opposite shoulders. So you're going to do this one laying down. And quite simply, what we're going to be looking to do is stretch out the low back, but also bring a stretch to the nerve. So one knee at a time, you're going to bring both hands on top of your knee, and you're going to bring it up and slightly over. So we're aiming for the opposite shoulder. Again, when you're doing this one, it's similar to that glute stretch or the piriformis stretch that we did at the beginning. But as you bring this one up, I don't want you to be lifting your low back. So make sure your low back is not lifted as you're pulling this towards the opposite shoulder. And you would be doing that on the leg that's the most affected. So those are my top 5 favorite exercises in order to stretch all the muscles of the low back that are most likely causing the sciatica or low back pain. The other thing that I really like about those exercises is they're also stretching the nerves and all the tissues are supporting it. So generally you're going to get a deeper stretch, and with any of these stretches, you need to make sure that you're not lifting your pelvis, you're not overstretching anything, but most importantly, that you're not re-aggravating the moment. And if this happens to you, stop immediately, and this is the perfect time to be going to consult with either a corrective care chiropractor or your family physician, so that way you can get more testing done. I hope this video helps you, and if you have any comments or questions, leave them down below. Don't forget to like, subscribe, and until next time, we'll talk to you soon.